Good morning. I will go ahead and call this meeting to order. This is the, what month is it? October meeting of the Incarceration Prevention Reduction Task Force. I'd like to welcome everyone that's here. We are meeting remotely by Zoom. Sorry about the clock in the background. It does 9 chimes. It'll end soon. The one announcement we want to make right now, just for everyone, and maybe Stephen, if we remember, we can do it at the end when a few more people are here, is we wanted to announce that the Behavioral Health Subcommittee meeting is rescheduled, and it is, and I lost what it was rescheduled to. Here it is. It is rescheduled to Thursday at 3:30. So Thursday the 8th at 3:30 p.m. And I'm pretty confident you'll also get an email regarding that. Any other call to order announcement stuff, Stephen?
I don't think so.
Jill may need to leave, Jill Nixon, for part of this meeting. And so we're happy to have Lisa Brunner from the county helping us. Stephen will likely do a little more of the chairing than usual, and I'm going to help with the Zoom facilitation stuff and if we have to do any roll calls. And I think that's probably all of the business we need. Is there any other business we need to talk about before we get started?
I'll just say, if everybody hasn't noticed, Jill has the agenda up on a screen for you to refer to.
True. And I think for some people, Jill, we actually may want to take that up and down, because I think people can't typically see people when the agenda is up, depending on if they have 2 monitors. So
sure. Would you like me to take it down now?
I think so people can see each other, and we can throw it up as we need to. And Steve, if you want to get us started, this will be kind of the steering committee and Barry and some decisions.
Yeah, we're going to start today with a report out from the steering committee on a variety of topics, several of which are action items and we'll vote on at the appropriate time. So your packet contains a draft land acknowledgement statement that the steering committee is recommending for adoption. Dan, you're listed. Is Dan on?
Yeah, I'm here.
Okay, you're on as the presenter, Dan. Take it away.
That's good. That means you get to go. Oops,
sorry. Jill Nixon, can you put up the land acknowledgement statement, please, on the screen?
Yeah, give me 1 moment.
Sure. For folks that might not be familiar, this land acknowledgement statements are fairly ubiquitous with our neighbors to the north in Canada. They've been doing this for years, if not decades. In the Bellingham City Council, I introduced a land acknowledgement statement that was similar to what you're about to see. And for a year and a half when I was president, this was read at every single meeting. I think it's the very, very least that can be done with regards to our acknowledging our Indigenous neighbors and friends. And the statement, as I'll just read real quickly. So before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We are gathered here today on the unceded ancestral lands of Lummi, Nooksack, Samish, and Semiahmoo people. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. I'll take any questions if there are any. Okay, seeing none, I'm going to make a motion to adopt this land acknowledgement statement.
Second.
I'm so sorry. It took me a second to jump in. Dan, great. Thank you for introducing this. I think land acknowledgements are critical, but I also see duplication of language from the first paragraph, just the exact same thing stated again in a sentence in the middle of the second paragraph. And maybe that's okay. Maybe that's intentional. But I think keeping it really concise and thoughtful gives it more impact. So I just ask you to consider that what I
Okay.
see is.
So what I hear is a friendly amendment to maybe perhaps strike the first paragraph and just go with the complete second paragraph.
I would ask you to consider it the opposite way, to strike the one in the middle, because it names the populations we're trying to acknowledge strongly in the first paragraph. And I like that. I want that in the forefront, but I feel like the
Okay.
sentence in the middle of the second portion is really just restating what was already said.
Okay, so to make sure I hear you correctly, so strike "we are gathered here today." That's that sentence, is that correct?
Right, because I think
Okay.
it's already been said.
Okay, I will accept that friendly amendment.
Is that accepted by whoever it was who seconded it?
Accepted.
Okay,
Dan, one point of clarification. I believe it's your intention that this statement be read at IPRTF at our task force meetings at the beginning. Is that correct?
That's correct.
And do you also want it read at subcommittee meetings?
It's up to I'm not going to be
Okay.
prescriptive when it comes to that. I'm going to read this at the behavioral health
Sure.
committee
Okay.
meeting. And if others want to do that, that's really up to them. But I felt like within the steering meeting that we could bring this forward to the main task force.
So the other friendly amendment I would offer is at the beginning, not just to adopt this statement, but clarify that the motion is to read this statement at the beginning of the IPRTF full task force meetings, because I think that is your intent.
That's correct.
So I would offer that as an amendment as well for clarity.
Okay, I
Yep.
accept both. And seconders, yeah, okay.
Mike, did I hear you approving the second on that?
Yes, yeah, I approve the amendment to that.
Great.
Remain a second.
So there's a motion to adopt the statement with the amendment of striking out the middle sentence in the second paragraph that duplicates the statement of the first paragraph, and to direct that this be used at the beginning of each task force meeting. I'm going to give everybody a second to unmute so we can take a vote on this. And I'll ask all those in favor to say aye.
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 Anyone opposed, say no.
This is Scott Courthouse. Could I abstain? I just haven't had time to review it. I'm sorry, I didn't. So I'd like to abstain on this one.
Yeah, that was the next question, Scott. Abstentions, so we have one. And none others. Okay, motion carries. And this will become our land acknowledgement statement for each of the task force meetings. Thank you, folks. Thanks, Dan. Barry, you're up for reporting on the recommendation to return to monthly meetings.
Yeah, good morning, everybody. How are you? It's been a long time no see, and that's kind of what we're going to talk about next. The steering committee has, both in our September meeting and our August meeting and September meeting, I guess this is October, we talked about how we kind of noticed that our task force has lost a little bit of its edge and its steam, and the attendance kind of reflected that over the past year. So we wanted to bring to the task force, to the full task force, the idea of going back to once a month meetings to keep us on track and keep our work products current and just, you know, be more engaged. So I would offer that as a motion. I would move that the Whatcom County Incarceration Prevention and Reduction Task Force return back to a monthly schedule.
Second.
I'll start out by noting that we had already approved a November meeting as sort of a special meeting. So we will be meeting for the last 2 months of this year as already decided. So this would take effect with the January meeting. And is there any discussion on the motion?
I can't tell if you can see my hand, Stephen.
I see you, Dan.
Sorry, Dan.
Sorry, Barry. Hey, I just support this. There's so much good work that's happening right now. I know we're in our bubbles to some degree. Over in the behavioral health committee, there's just a lot that's happening with a lot of discussion about co-responder models, LEAD program, et cetera, just all the different types of programs. And I want to make sure that we don't let up on these very important programmatic pieces. And I think as it relates to the broader task force, those going every other month, I think Jack or someone just said it, or perhaps Stephen, we lose steam when we do that. And right now there's so many things that are happening. I just don't want to lose momentum. And so that's why I support the motion.
Other comments? I can't see hands. Jack, are we okay?
Yeah, we have no hands up.
Okay. So please unmute. And we'll call the vote. Returning to monthly meetings, beginning with January 2021. All those in favor say aye.
Aye.
All those opposed say no. And any abstentions? Motion carries. Thank you very much. Folks.
Thanks, everybody. I really appreciate your enthusiasm, and we're going to knock it out of the park next year.
I have
Thanks.
a question. Just Jill, I don't know if you know when the new schedule will be circulated. Just the sooner the better would be great.
Generally, I work the schedule around the Bellingham City Council and Whatcom County Council meetings, and those usually are put together in late October. So I should hopefully have something in November.
Thank you, Jill.
And to clarify, it's my understanding we won't have a December meeting. We'll have November, and then the monthly will commence in 2021, starting in January.
That's correct.
Okay.
Hi, this is Heather Flaherty. I'm not sure if it's okay to make a comment right now. Thank you, Stephen. I am curious about what else in that conversation you had about perception of dwindling interest or momentum. What other ideas or solutions were discussed other than adding additional meetings? And
Barry,
if
you want to take that on, Barry? I know he's going to do a steering committee report, and I think that will come out, but if you want to address this now, it seems timely.
Well, this is kind of, we're in the middle of our steering committee report because the way this is broken out, we really didn't have if my memory serves, we didn't really have an alternative plan other than, our subcommittees, we rely on them to do, the heavy lifting, but we just felt that there was a change in attendance. There was just a change in kind of the feeling and the energy when we went to every other month. And it just, then we hit COVID, of course, and it stalled us even a little bit more. But, the group really felt strong about getting back on track with the once a month schedule.
Heather, if I could just add to Barry's comment, I think one of the points we pretty generally observed across the board is the committees are meeting monthly as we've started to come out of the pandemic restrictions and start meeting again. They're generating a fair bit of work. And we recalled that our ordinary structure of a task force meeting involved informing the whole task force of committee work by reports. We often had guest presenters or topic focuses. We had time for discussion and debate. And when we went to every other month, we were piling up, just reporting out the work that had been done, and we were missing a little of the creative and informative aspect that the task force's work had in prior years. So we were hoping to get back somewhat to that approach.
before we go on to the next order of businesses, we're all getting more acclimated, or Stephen and I anyway, to Zoom. As far as hands, the easiest ones to see are if you use the blue hand, which is your raised hand that you typically would see at the bottom of your screen, or off to the right on the participants list, depending on if you're using a computer and an iPad. If you don't have access to that, if you move your hand like this, I'll see you. And Stephen, what I'll do if we get multiple hands, I'll let you know that we have Heather, then Dave, then Dan, or whatever it is, so people know we've seen you. So I don't want you to have to do this the whole meeting. So we'll figure it out. We'll try to communicate that we know your hand is up. And if we miss you, please go like this so we know that we've overlooked you. And I think we're ready to, pretty close to make Mike a co-host, right? Stephen?
Yes.
Are we done with, yep.
Mike is the co-host.
Yes, so out of steering committee, Mike Parker, the steering committee unanimously, I believe it was unanimous, recommended a motion for the adoption of a racial equity toolkit. That presentation was made to the steering committee by Mike Parker, and the steering committee requested he make that presentation here today prior to this motion being considered.
All right, I'm going to attempt to share this screen. Okay, can folks see that? And can folks hear me?
Yep, both.
Both the above, wonderful, okay.
Apologies in advance if you've already seen this. I think some of you.
Another piece just to share with you all. Obviously, just I offer this to you in a space of humility. I'm not a person who's oppressed. Who's had these issues. I'm a person of white and who's privileged. And in some ways, I may be not the best person to make this presentation to you all, but I appreciate you listening. I think you're getting me because I'm earnest. I really am passionate and I care about this. And I just want to honor the perspectives and lived experience to those that may be in the room, and certainly those that are outside of the room, because this is really why we even have these kind of discussions. I want to thank the committee too for letting me do this one more time, and hopefully this will be interesting enough. So a lot of communities are looking at how do we respond to issues like George Floyd and the protests surrounding that, and the need for greater transparency, and how do we reform our systems. And I think racial equity toolkits and frameworks really provide task forces like ours with a blueprint, a map, if you will, to follow. This particular one that I'm going to show you, and Jill, I think, attached the toolkit itself to your packet this morning, comes from the Local and Regional Government Alliance on Racial Equity. Just the title alone, I think, tells you why we looked at this one and why we think this one would be the best fit for this particular task force. It's born from groups that are working to achieve greater racial equity and to make reforms, but it's specifically within the context of government alliances. Our nearby neighbor city of Seattle, for example, is a well-known member of GARE. What I'm talking about today is adoption of a racial equity toolkit. This particular lift is free. They're available on the website. We can implement this today. I think the county is going to hear, as the Public Health Advisory Board is going to hear a request for membership, which would take us even farther and would be outstanding. But hear me out on the racial equity toolkit. I think it's something we can do regardless. So obviously we're gathered and our purpose together is really to reduce incarceration. And we're hearing, and I know many folks, whether you be in politics or not, we are hearing loud and clear from constituents, from listening sessions, from protests, that we want a criminal justice system that keeps us safe. We want a society where our children thrive and prosper. And we want a system that's just and equitable for all. And what we're having right now is not meeting that. The racism in our justice system is baked in and hard baked in. Comprising 64% of the US population, whites represent 39% of the prison population, whereas African Americans are 13% of our US population and over 40% of the prison population. I share these are nationwide statistics and come from the Prison Policy Initiative. We have our own issues here and we have our unique and local issues here, but I think that really highlights just how broad and how deep this disparity is. This was really compelling. I'm in the process of reading this book, and if you haven't, I would highly suggest it, but it's How to Be an Anti-Racist by Ibram Kendi. I want to read this quote to you very briefly. There's no such thing as a non-racist policy. There is no such thing as a non-racist or race-neutral policy. Every policy in every institution, in every community, in every nation is producing or sustaining either racial inequity or equity between racial groups. This is fascinating because I think in our context, there have been lots of rules and policing rules that were not necessarily overtly racist, but the impacts really are. So in the IPRTF, our great acronym, Incarceration Prevention Reduction Task Force, we have an opportunity to be leaders in our community. We have been since 2015 in recommending reforms, enhancements, pretrial risk assessments, and electronic home monitoring. I mean, the number of ideas generated in this group is wonderful. We have an opportunity to continue leading this charge, but to do so in a much better fashion, in a much more intentional fashion with regards to racial equity. And I think that racial equity toolkits will help us move the needle on that. Why adopt a racial equity toolkit? I'll just read one of these. These are two great reasons, and these are straight from the Government Alliance on Racial Equity. But too often, policies and programs are developed and implemented without thoughtful consideration of racial equity. When racial equity is not explicitly brought into operations and decision-making, racial inequities are likely to be perpetuated. Racial equity tools provide a structure for institutionalizing the consideration of racial equity. There was some really good conversation from some of these presentations. What would it look like? And really what it is, it's all about operationalizing the questions of racial equity and looking at impact. Who will it benefit? Who will it hurt? GARE's racial equity tool proactively seeks to eliminate racial inequities, helps identify clear goals and objectives and outcomes. It makes us engage the community in decision-making processes. It helps us identify who will benefit or be burdened by a given decision. And it also assists us develop mechanisms for successful implementation and evaluation. I offer you the Racial Equity Toolkit. Obviously, the packet that's attached for you all, you can see there's many, many pages of extremely helpful context and framework. But essentially, a Racial Equity Toolkit is just this. It is a simple set of questions that you ask anytime that you propose a change or reform. I'll just read the highlights. The first question is about the proposal. What are you trying to do? And what are the desired results and outcomes? Number two, the data. What is the data? What does the data tell us about our current state? How will we benchmark what our change has done? And any unintended consequences from the change that we implement. Number three, community engagement. How have communities been engaged? And I think for us in the task force, we talked about this in steering, we really want to make sure that we're dealing with communities that are affected, that are most affected by our justice system. And we think we have real opportunity to include more of those voices and in more constructive ways. Number four, analysis and strategies. Who's going to benefit from your proposal? Who might be hurt or who is left out? And what might be some unintended consequences and how might we mitigate them? Number five is implementation. What is your plan for implementation? And six, accountability and communication. How will you ensure accountability, communicate, and evaluate the results? The Racial Equity Toolkit is essentially just the beginning. It doesn't fix your system. It doesn't reform your system. It doesn't do your analysis or your assessment for you. But it provides a pathwork, a framework to operationalize and to force us to ask these questions every time. And it's just the beginning to help us shape that equity framework, which will in turn help us create more just and equitable policies. And it provides powerful information to us as we move forward in a more inclusive and equitable process. In your packet, I think that you've got today from Jill, you should all have the actual Racial Equity Toolkit itself. Again, this particular item from GARE is produced free and is available to us. We can implement this today. At steering, obviously, we have talked about this, and our goal was to expose people to the concept, to see a little bit about what the Racial Equity Toolkit looks like before calling for the question. But I think now that we've all seen it, I think it's kind of the minimum that we can do. And I'd like to ask that we vote on this today. I'm also available for any questions if there are any.
And hopefully everybody can see the motion that Jill just put up. And so this is the motion that was approved unanimously at the steering committee that would implement the actions Mike is proposing.
I think I can call on you, Dan.
Oh, yeah, I can't tell if you can see my blue hand or not.
Oh, I can now. Thank you. Just, yeah. Dan.
Okay, so I'm gonna go ahead and move that we adopt the GARE Racial Equity Toolkit. One thing that we had talked about probably starting maybe a year and a half ago was looking at like upstream issues that might cause a person to come into contact with the criminal justice system, and we labeled those social determinants of health. I don't know if y'all recall that. My understanding is that the mayor and the county executive are looking at addressing racism as a social determinant of health that affects people greatly. So I think this, as Mr. Parker said, would be the bare minimum that we can do to address racial issues through the work that we do. We know that the criminal justice system is overwhelmingly disparaging to people of color. That's just a fact. And so I think it's very important that we have a framework when we're going forward with our recommendations to county council, that those recommendations have gone through a process like this or this, so that we can have some confidence that we've addressed the racial inequities within the system. So that's my motion. I'm gonna move to adopt.
I think for purposes of the audio recording for people listening later, it'd be appropriate to read the motion so it's in the record. So I'd like to do that now. So this is a motion from the steering committee that I believe Dan Hamill just made the motion, and it states, recommend using the GARE toolkit in the work of the Incarceration Prevention Reduction Task Force and their recommendations to the county council, and in the recommendations and work of the IPRTF subcommittees, intent to promote racial equity in all the work of the task force.
I will second Dan's motion.
Hey, and we've got Executive Sadhu and Mayor Courthouse.
Yes. Good morning, everybody. And I know I don't attend these meetings regularly, but I thought that today is important because of this topic. I just wanted to share that in our next biennium budget, I am actually already allocating money for a racial equity commission. I have shared that with council, and there were no objections, but of course the budget is going to be presented and there may be some discussions on this, but the initial reaction was quite positive. And I have been in touch with Mayor Fleetwood as well and asking them to do that. Our aim is, at least direction is that we should form a commission just like we have a DV commission in our community on a more like permanent basis, and where it should not be only Whatcom County and City of Bellingham, it should be a county-wide and have participation from all other entities and jurisdictions as well. Now, as far as this is concerned, I think that more we can do about racial equity in different segments of our organizations and our works. It cannot be just if we have a racial equity commission, then we should say, okay, we don't have to do anything, they will do everything. I mean, like we talk about the pervasiveness of this thing over years and years and years. it is only taken care of, and we, in all of our deliberations, processes, governance, everything, we bring this to the forefront. In whatever manner, whatever way it can add to that alleviation, I think it will be good, or mitigation. So I welcome, taking a step like this. And I'm asking people that don't look at Racial Equity Commission be all and end all type of organization, but it could be leading. But I think we need to take action at council levels, all kinds of places. I don't want to name everything. So thank you very much. And I don't know, I don't even have a vote, but I really support something like this. Thank you. Thank you.
Thank you, Executive Sadhu. Mayor Cortez.
Yeah, so I represent all the small cities, and I didn't get this. Well, we all didn't get it till mid last week. So I guess I would like to get some input from my other city mayors before I vote. So if we could put it off the vote, I would appreciate that. If not, I'll probably abstain again.
Thank you. Is there other discussion? Okay, seeing no hands, Stephen, do you want to do the, is there, no?
Oh, by the way, Sat Paul does have a vote.
Oh, yeah, well, yeah, he does. Tyler, yes, he does.
Okay.
Go ahead, Stephen.
So you want to have the vote, Jack? I think we have a
Well,
suggestion.
I guess actually you could, there actually is a motion to table, I guess is how we would describe that.
Right.
I think that's what was proposed. Does that seem right?
Yeah, I guess I would move to table. That way I get some time to review it and see what's all in here. This is a pretty big document, and I really not that familiar with it.
Okay, so we can deal with the motion to table first. I see Maya and Ray.
Sorry, I don't have the little.
No problem. I see your hand. So we've got, and we have, I think Ann was ahead of you. I apologize because I'm so I've got Ann Deacon, Maya, and Raylene in that order.
Thanks. I just want to say that we've heard about this particular toolkit. I think there's others out there, but I really want to honor the small cities. It's important if we're going to do something like this to make sure that we, as a collective community, not only agree on the tenets, but also on the process for moving forward. Obviously, one of the positive things about this toolkit, it has some great questions that we can ask ourselves as we consider various programs and services and policies. But I would like to support Mayor Cortez's motion.
Okay, and one piece of information, so everyone understands, our next meeting is November 2nd, which is coming up relatively, so it's not that far away. So just to be clear, we're talking about tabling to the next meeting. That next meeting is not 2 months away. It would be November 2nd. Okay, I think I said Raylene and then Maya, or was it Maya and Raylene? I don't remember what I said.
Maya, Lisa, and Raylene, I think.
Okay.
Oh, thank you. My question, I guess, is just like, who will be tasked with implementing this within our task force? Will it be the chairs of each committee who are bringing this forth in all discussions? Or I just wonder how we use it a little bit, if I could get more information.
Mike, do you want to respond to that?
Yeah, I was going to give it a whirl. So again, I may not be the absolute best because I'm not the foremost expert in racial equity toolkits. I think to some degree, some of those, the nitty gritty, we're going to have to work out as we go. But by adopting it officially at both the task force of the whole and all of the subcommittees, the thought is we would ensconce it in a process. And in some of the subcommittee meetings, we talked about this. What would it look like? And it would probably come in the creation of a new proposal. So if we're going to expand charges that somebody can wait at home and for their court date, for example, then we would want to analyze that proposal from the very beginning. So it would need to be incorporated, I think, formally into every process. And as such, it is normally chairs that keep us to heel when it comes to our process and remind us of our duty in our process. But I'm hopeful that all of us will internalize this as being important and all use it to the best extent that we can. I hope I answered that somewhat, and there is more in the toolkit itself that goes into the specifics of how to operationalize it.
Thank you.
You, Mike, Raylene?
Yeah, I wanted to second the motion from Mayor Courthouse as a small cities representative myself. I want to make sure everybody has adequate time to understand the toolkit and have any more comments or feedback on it. The Law and Justice Committee, when we get to that the agenda, we will discuss that. We discussed racial or implicit bias and racial inequity, and I think everybody is in support that we want to promote racial inequity. We want to work on this, but it wasn't something that was presented at the Legal and Justice Subcommittee, and I would like the opportunity for them to give more feedback and review it prior to making an official vote at this meeting.
Thank you, Raylene. Dan, I think your hand is up.
Yeah, so I would, I'm hearing the feedback, and I realize that it might be going a little bit too fast for some of the stakeholders involved. And Mayor Cortez, I do want to respect your motion to include the other small city mayors. I think getting more buy-in on this topic, on this toolkit, will make it stronger. I'm willing to wait until November. My question, Mayor Cortez, is would you be willing to forward this information, maybe along with Jill Nixon's help, to the small city mayors and get some feedback from those mayors? Is that what you're proposing?
Yeah, we have a meeting the third Tuesday of the month. And so I will get them all the information before that meeting. And then when we meet, we'll discuss it and come to a consensus, and maybe we'll invite Raylene as well so she can hear it, since she's a small city rep as well.
Okay, I would, hearing that and hearing Raylene's comments, I would go ahead and retract the motion, and I'd like to reset that motion for the November meeting. I know that we don't have to formally do that, but that's what I will do.
Dan, I think it might be better process-wise to just leave it as it is, seconded on the table, and we can make a very quick decision. It seems to me the consensus is going to be to support tabling it, and that way it's already there as old business for our next meeting, if you're okay with that.
That works.
Okay. All right. Mike, yes, your hand's up.
Yeah, I was just going to offer, by the way, I'm supportive of that. I mean, there's part of me that thinks there's absolutely no time to wait. But on the other hand, we move a lot better forward when we move forward together. And so I agree with Dan and Mayor Cortez. I also wanted to offer, if it is at all useful, myself could either attend your meeting for a quick 5 minutes, go through slides, or I could get somebody smarter. It may be helpful to have it presented. I know for myself, I've looked at it a bunch and read a lot, and it is more useful. So please let me know if that would at all be useful in your discussion. And I look forward to voting on this again in November.
Okay, thank you. I think unless someone has an objection or wants to say something, let's make the motion, or let's make a decision on the motion to table. All in favor of tabling the motion to consider the Racial Equity Toolkit to the November meeting, please say aye.
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 Aye. Aye.
Is anyone opposed? And does anyone wish to be recorded as an abstention? Seeing none, that motion then will be old business carried over to the November meeting. Thanks, everyone. And Stephen, we've got a little slight shift to the agenda with permission of Ann, Barry, and Dan, who were next. Unfortunately, Caleb Erickson had something arise, and he can't be here, but Tyler has graciously agreed to share a little bit of what he knows about Index, but he also will have to leave. So I would like to go out of order and go to the Index Committee report now, and then go back to the behavioral health and law enforcement co-respondent programs. As long as no one objects to that, we'll proceed in that order. All right, Tyler.
Yeah, good morning. Tyler Schroeder, Deputy Executive, Whatcom County. The Index Committee meeting met in September, on September 10th. It was pretty well attended. A lot of what we did was work on recognizing the next committee chair. So I have submitted my resignation from Index Committee Chair, and Caleb Erickson has graciously accepted my nomination and the vote from the committee to be the chair moving forward, which will be a really good thing. Caleb's tied directly, Lieutenant Erickson's tied directly into the jail data and has a really good background on how that works and what kind of information the data that's collected in the jail can provide. The larger Incarceration Prevention and Reduction Task Force, and also kind of clear understanding of what that data can't provide. And that's also kind of pretty important as we move forward, as we have found over the time. So that was a lot of what we worked on. We did also talk about kind of to the last discussion there, we talked about racial and ethnic statistics in the criminal justice system. The steering committee had asked Index to look into that and see what type of data we are collecting and what type of data we can be collecting moving forward. So at the next Index committee, which I think is late October, early November, Index committee members will be coming back with a list of racial and ethnic statistics that they collect in their own section of the criminal justice system, so that we can kind of compile that and bring it forward to the task force as a whole, to start talking about some policy issues and where we can move forward. Councilmember Buchanan also reported on the MacArthur Grant program, which involves 18 counties around the country that are engaged in peer learning networks to study racial and ethnic data and disparities, including the mental health field. And he is hopeful that some of the data that we're compiling or discussing from the Index Committee will help his conversations, and then also vice versa. So, you know, nationwide, there's an organization working on this topic, and he's hopeful that it'll be able to inform us locally moving forward. And I don't know, Councilmember Buchanan, if you want to hit on that topic anymore?
Yeah, just briefly, Tyler, thank you. Yes, this MacArthur grant, this phase of it is looking at racial disparities and behavioral health in the criminal justice system. And we had our meeting, our team met last week and decided to add the what Executive Sadu was talking about, which was the Racial Equity Commission, to that work plan that our committee is doing, so we can get some information from these counties and other experts around the country on how they formed and some of the elements that they're using in their programs. So we want to take broad advantage of all the expertise that this peer learning network can offer us as a county. So we're including, of course, the behavioral health stuff was already in the plan, and we've now added the Racial Equity Commission to that plan. So we're pretty excited that we have a very robust plan that in a lot of instances we're the leaders, we are the presenters in a peer learning network scenario because of the work that this group has done and others. So it's really a privilege to be a part of this group, and I'm optimistic that we're going to get a lot of good information back.
Thanks. And then I would just say to recap or kind of next steps for Index is probably similar to what the task force as a whole talked about early on, which is just picking up the momentum that we really had kind of late last year and re-engaging on the topic of data exchange. So we had developed a matrix that had all the different data and the data collections in the criminal justice system. We're going to reanalyze that, add this information about racial and ethnic city statistics, and probably re-engage the task force as a whole to see where they want to go from a policy standpoint. One item that I would just leave off, since I no longer will be the index chair, committee chair, is, you know, the task force as a whole may want to think about bringing in some expertise into our community to kind of help guide the conversation about what's next with the data that we've been collecting. There was a lot of policy perspective that I think the index committee could respond to in a favorable way, but would be looking for a little bit of direction, either from the task force as a whole, or maybe, as we've talked about in the past, bringing some expertise in to kind of give some additional guidance on where to go. But over that's kind of the recap from the index committee. I have enjoyed being committee chair and will enjoy moving on to other topics as well, and I know that Caleb will step right in, and his shoes are bigger than mine, so he won't even have to fill them. So that's good. Thank you.
Thank you, Tyler. Are there questions for Tyler? So just on behalf of the task force, Tyler, I know you've been busy and seeking a replacement legitimately for many months, and thank you for continuing to be there for this handoff in these difficult times to hand things off and do this kind of work. Really appreciate it. Stephen, back to you, and back to our previously scheduled programming.
Okay, I'll add my thanks to Tyler for getting the index committee off to a solid start and getting it ready to gear up again. So we're back to the topics under the steering committee report agenda item. And we have Ann, Barry, and Dan to present an update on behavioral health and law enforcement co-respondent programs that are in discussion or in the beginning stages of implementation. I don't know, Ann, are you going to start with this?
I'll kick it off, Steve, because I'm just going to kind of introduce the topic, and Ann is going to provide all the details for us. So we've been talking about budget priorities all summer, the council has, and one of the things that came to the top was a co-responder model, or expansion of GRACE, or some way to have you know, a better way to have behavioral health responses from, you know, professionals. So Ann has been working hard. I don't want to get ahead of her at all. So I just wanted to introduce the topic and let her carry the ball for us this morning.
Well, good morning. Obviously, this has been a big topic, not just locally, but nationwide as well. And so my recommendation to some of the policymakers is that we begin to facilitate and lead this discussion out of the GRACE programs management team, that this is a team that works very closely, not only on GRACE, but expanding LEAD, and also developing linkages among many, many different response systems, EMS, law enforcement, the hospital, all of our different outreach teams and everything else. So that was really the recommendation for why we should have the continuity to make sure that we didn't either duplicate efforts or miss huge pieces of the system. Obviously, a number of people will be part of the planning process as we move forward, but the planning process does include making sure that we look at everything we have now. So for instance, we obviously have a 911 dispatch system, but we also have in our community an unarmed dispatch system. So some of the questions obviously we're going to be asking and looking into is how do we align with current programs? Do we build bridges to create a system? Do we make some major changes to a current system, et cetera? So there's quite a few things we'll be looking at. We'll also be looking at resources that we have relative to personnel expertise. We're a mid-sized county, but this is really hard work. And so there's only a certain number of people that can do this work. So we want to make sure we optimize the resources we have and that we have the support not only for the people who do this work, but that there are programs and services in place that you can connect people to once we do intervene and, begin to engage someone in alternative behavior rather than having to always come into contact with law enforcement. So my understanding right now of the goals are really to reduce unnecessary law enforcement contact with people that would probably be better served by other systems, especially people with behavioral health expertise. And obviously part of that is improving and expanding upon the behavioral health systems we do have that can actually support those people. I think I'll leave it at that since we're at the very early stages, but we really want to make sure we have a purposeful, thoughtful plan like we did with GRACE so that we can have the same kinds of positive outcomes we've seen with GRACE. And maybe Dan, I'll turn it over to you with any others.
Thanks, Ann. I agree 100% with what Ann just said in terms of making sure that we do this very intentionally and moving forward, that we don't duplicate or disrupt any of the current programs or systems that we have. I'd like to provide just a small update. So I'll go into a budget session here this afternoon with my fellow council members and the administration. You probably read in the paper that the mayor intends to double the funding for GRACE program. So 140 going to 280. The police chief, Dave Dahl, has made a proposal and worked with the mayor to add 3 behavioral health officers to that program. So that'll be a total of 4 behavioral health officers coming online. We'll have that discussion this afternoon as well when Bellingham Police present their budget. And then the other item is creating a line item for a 911 co-responder model that Ann Deacons was just kind of mentioning and outlining there a little bit. So those 3 components are, I feel that those are major. I don't feel, I know that those are major wins for our community. I think what's important here is what's the best response for the patient, what's the best response for the family of that patient, and what's the best response for the community at large. And so those are the lenses that I'm looking through as we move forward. A lot of exciting things happening within behavioral health. I think that's really what we've heard a lot from folks, from constituents who are writing in. There's a defund movement, there's a fund movement. There's 2 sides of this thing. We get letters from both broad constituent groups. And what we hear, if you strip some of the politics aside, what we hear is that people with behavioral health issues are not getting the treatment that they need. They're not getting the interventions that they need. So I think that these are definitely front end system components, and we do need to do a lot of work on the back end, but these are things that we can control, and these are things that we can implement. And just if there's any doubt on that, think about community paramedic. When I started 6 years ago, we had just started that program, and we didn't not do it because we didn't have a complete system. We went ahead and did that program, and a lot of patients have been treated successfully. They're in their own homes now. And so I just looked at that program for inspiration when we're thinking about our other 911 co-responder or other similar programs. Thanks.
If you don't mind, I'd just like to add to Councilmember Hamill's comments, which is that I feel like we have a foundation already there. We have a lot of people energized and ready to do this work. It's just taking it to the next level. So I really support Ann's and, of course, my position in that particular group to develop this, because there's a lot of work that would have to be done in our dispatch center, certainly training of personnel. And there's even state level implications with what we're doing with our community paramedics, because we're trying to change that scope of practice and allow them to do more of this work out in the community. So appreciate that, Councilmember Hamill, because we would like to develop this in a bigger way through all of these systems that Ann mentions.
I'll interject a comment here.
I was going to say, Stephen, you've got your hand up. Yep.
I'll take it down. First, I'm glad to hear. When I first heard co-responder, I was concerned because my reading of the community feedback is quite strongly to have at least an appropriate portion of calls exclude law enforcement involvement. And so co-responder sounded like it did not do that. And what I understand is that you are looking at those options. So I'm relieved and look forward to hearing a little bit more about that. The second part of my comment is at least one of the task force members has asked for, to the extent it's possible, for presentations of some of the program models that are being considered. Cahoots out of Eugene, I know City Council in Bellingham had presentations from a Portland program and a Salt Lake City program. So rather than just passively follow along after the fact of these planning discussions, if there's a way that the Grace Leadership Group and you, Ann and Dan, might bring some of this direct information about some of the program options that you're weighing as you move forward in that, I think that would carry the task force along in a more active and informed role.
I will just say that we've looked at quite a few different programs across the nation, but I think it's too early at this point to adopt one. We have to first make sure that we thoroughly understand what we have in place and what our final goals are before we can really begin to do that. I don't want to create false promises by saying we're going to duplicate a program. With Grace, we started out with a program in mind and ended up with something uniquely our own. So I just want to make sure we don't put a blinder in front of us by just glomming onto somebody else's program. But as we get closer, we absolutely will not only present some of those programs, but also what we did with Grace is that we looked at the common elements of successful programs to figure out, does the program we're designing have this element? And that's how we developed Grace.
Thank you.
Yeah, I agree. It's a little bit early. It's a little bit premature to roll out some of those examples until they get vetted a little bit further. I think we might be able to come back during the first part of next year, perhaps, hopefully, with more clear information. But I think that process of vetting has to be done. We have a lot of moving parts within our own system, and Deacon brings up a really good point that if we were to rush to implement something, I think it would be rife with mistakes. We have to do this very intentionally and do it well and integrate it into our current system. So Stephen, I'm hoping that we can present, maybe in a few months when we get a little more information and get things more sorted out.
Okay, I see Heather, and I don't think are there any other hands after Heather? And Heather, a minor complaint. I liked your video better with the baby, but it's okay.
We'll see if she's quiet for this comment. Dan, did you say that Mayor Fleetwood is putting 3 new behavioral health officer positions in the budget? And I do have a comment after you answer the question.
Yes, that's correct.
Okay. Just speaking as a citizen representative at the task force, I feel like I'd be remiss if I didn't say that obviously there's a lot of community interest in this idea of reallocation of services and providing treatment instead of incarceration. And I think this is a really great opportunity to look at using something like a racial equity tool to, as you're going through the process of developing alternative models. And so I just want to offer that as a citizen representative, and also, of course, to incorporate lived experience and those voices at the planning table, which I think there is a lot of interest in at the moment.
If I can respond, I agree with all of that, absolutely. And then I would just add to that, in our afternoon discussions today, I will be asking the police chief and the mayor for qualifications, background, and education as it relates to filling those positions. I think that you know, we've done a really good job, we being both Bellingham and Whatcom County, in terms of being leaders. Barry, Councilmember Buchanan mentioned that in our MacArthur Foundation calls, that we often are far ahead in some ways, not every way, but in some ways. And I want to continue that with this behavioral health officer program, that let's be the best we can be. Let's be the leader in Washington State, and let's be the leader in the whole country. So I will be asking those questions today. Thank you.
Stephen, I don't see any other hands. And you were muted.
I'm sorry, everyone. Okay, Ann, Barry, and Dan, we look forward to future updates on this and more information as the vetting process proceeds. Dan, thanks for your work on the budgetary aspect of that with the city. And we'll now move into the report from the committees. And I think the first one on the agenda is the Legal and Justice Systems Committee. Raylene, are you prepared for this? I didn't see it.
Prepared as I'm going to be. So thank you. And I'll just briefly touch on what we did in August and September. And Stephen, if you can fill in any gaps, my co-chair is unavailable today, but our August meeting, I think, was really great on implicit bias training and racial equity. Chief Tanksley spoke about the implicit bias training that he has provided to many law enforcement members in Whatcom County. And I'm not going to read into everything that happened there, but the committee members and Chief Tanksley discussed how creating change came from the top of the agency. And the Harvard implicit bias test was mentioned several times. I believe Dave Dahl mentioned it, Chief Tanksley mentioned it. And it was, you know, that there is biases out there and we're not going to get rid of them, and everybody has a bias. And if you don't think you do, it was an encouraged to actually take that test and go online. Because I think most of us that have done it are surprised with the results, thinking that we don't have any biases. And so he wanted to emphasize that we need to make changes, and that we want to have a racial inequity toolkit. And I just felt that with the toolkit that was provided, which I think is excellent, I just wanted more feedback because it wasn't presented at the last meeting. So I just wanted to touch back on that. Racial equity was discussed by Sheriff Elfo, and something that we've learned is in 2019, the FBI no longer counts the Hispanic ethnicity, and they're counted in race and with the race they identify in. And that's a definite concern. I believe Carol Donovan mentioned that 10% of the population identifies as Hispanic in Whatcom County. And so there was concerns that we want to make sure that if we are using these toolkits and we're trying to be unbiased and equal, that we want to make sure that that data is included. And Sheriff Elfo assured, even though the FBI wasn't counting those numbers, they were going to make an effort to make sure Whatcom County's numbers and the systems that we're using are able to provide that information. Melanie Campos with Lummi Law and Order, she actually did provide some statistics as well on poverty and unemployment. And I thought that was really important to continue to include Lummi Law and Order and to get that data for future information, future meetings, because they're a contributor to this county as well. We can't leave that out. And that was also mentioned in Dan Hamill's introduction at the very beginning of the land presentation. And then moving on to the September meeting, we spoke about the behavioral health re-entry program. Mitchell reported about that. They do have somebody on board, but the committee discussed recommending that the task force write to the MCOs asking that they fulfill their contractual obligations and fulfilling the obligation with the MCO hired reentry staff who travel to the area twice a month, and whether the healthcare believes that that's going to fulfill that gap. So any information from the behavioral health unit on that would be appreciated if we need to work on that further. Any questions on that before I proceed? Okay, we had an update on the pretrial services unit by Judge Garrett, and we also had a presentation from Rajiv Majumdar on pretrial services that are used in the courts of limited jurisdiction. Obviously, pretrial services for courts of limited jurisdiction have been ongoing, and the pretrial services for Superior Court is new. The pandemic has had a major impact on that. There's no in-person contact between the pretrial services and defendants. The risk assessment tool is currently on hold, and the future is kind of bleak, not knowing what the budget cuts are going to do to the program. But there does seem to be a need yet for it, and some frustration was brought out of statutes that say that we can have pretrial services mandated for misdemeanors and not always for felonies. We did determine after the meeting was over that there is a statute under DUIs that actually does require pretrial monitoring for any defendant that's been charged with a DUI prior to have some type of 24/7 monitoring that might help push, because I really do think the pretrial services unit and all they've accomplished, we don't want it to fizzle out. So anything that the task force can do to keep that going and work on making that proceed. I'm trying to think of anything else that I might have missed. I went pretty quick. And do you think there was anything I missed, Stephen, or want to add to it?
No, I think that was a good and comprehensive summary, really. Thank you.
Any questions?
I guess I would ask Anne whether she thinks and might consider putting forward a request for the task force to write to the MCOs on the reentry question.
So that's a very interesting topic. We actually, the State Association of County Human Services had a meeting last month, and we invited the healthcare authority who holds the contracts with the mental health or with the MCOs, the managed care organizations. We told them at that time that we felt like some of the obligations that the MCOs have under contract are not being met. And we did bring up this issue as one of them. And so I think we have kind of a two-pronged approach. One is to make sure that we're clear about the contractual arrangements the MCOs have with their funder. And we have an outline of some of those points. We also need to think about our strategy maybe on a broader sense of how we work with the healthcare authority to understand that the performance measures and metrics they have with their MCOs are not necessarily going to meet community needs. And our community is no different than any other community in the state, in the sense that criminal justice involvement for people with serious mental illness has a lot of need for improvement. And when most of that money is going to the MCOs need to be part of the community discussions. That also applies to our Crisis Stabilization Center. There are still negotiations underway between the two providers of service at that new facility with the MCOs, and they are struggling to get operational funding to fully cover the costs. And yet, as we know, this is a critical hub for our behavioral health crisis response system in our community. So I would say that once we hear how the negotiations go with the Crisis Stabilization Center, then I think we should maybe craft a strategy and then some letters to start not only addressing our concerns that the MCOs aren't really invested in a community system of care, but that we should not only talk with the healthcare authority, but maybe the governor. And then we have a legislative session coming up in the state starting in January, and maybe we also bring some attention there. We brought attention there once before and not only got money from the legislature, but also from the governor. So I just think we have a lot of work to do to make sure we bring these MCOs closer to the ground and the needs of each community in this state.
That was very informative, and part of what I got from that is you'll be back with an update on that.
It is a constant, it keeps me up at night. This is what I work on a lot. Yes.
So we do have a hand up. We have Greg Winter.
Yeah, thanks, Jack, and thanks, Ann. And I just want to express my appreciation for your strong stance and the need for advocacy on this. I think about our Recovery House project, which I think some of you are aware of, that's primarily designed to help support people who are participants in our therapeutic court programs, so that we hope that that'll be up and running next spring, but there's big questions about the operational funding through the MCOs. So yeah, we need a lot of support in Olympia, or maybe short of that, maybe in negotiating with the MCOs, but I suspect that we'll need to be active in the legislative session come January. Thank you.
I don't see any other hands, Stephen.
Okay, thank you very much, Raylene, and thank you, Ann, for fleshing out that reentry issue. So the next item on the agenda is a report from the Behavioral Health Committee, and that would put Dan and Mike up.
Okay, Mike, do you want me to start this off, or?
Dan, that'd be great.
Okay. I'm just going to go back here. So we met on August 3rd with the Behavioral Health Committee. A lot of the things that we discussed were brought up today. So the GARE Racial Equity Toolkit, CAHOOTS, we talked about the HOT team, the PACT, the Program for Assertive Community Treatment, a number of different items that have kind of bubbled up today. I do want to put Heather Flaherty and Dean White on the spot here. One of the things that we had talked about in August was youth intervention and prevention, and that Ms. Flaherty and Mr. White would come back to us at a subsequent meeting to provide us with any updates on youth intervention and prevention. On September 21st, we talked about agency needs as relates to changes to related to COVID. Boy, there were a lot of really heartfelt responses in terms of, the things that all of us are dealing with, and how law enforcement, fire, EMS, and how everyone's just trying to do their jobs and make sure the patients and folks are getting that their needs are getting addressed. We'd also talked about expanding committee representation, specifically with folks that are impacted by the criminal justice system, making sure that we provide a safe space for people from marginalized communities or communities of color. We talked about some kind of technical ways to maybe that our format wasn't the most inviting, that it could be intimidating, and so we're trying to work through those issues. We talked about communications planning. My perennial beef with government is that I feel like we don't do a good enough job in terms of communicating our successes, our challenges, and our needs out to the broader community. So we talked about, this meeting right now is on video, which our normal task force meetings are not. They're on audio only. And Mr. Gockley brought up some good ideas about like time notation. So a person that's wanting to get to a specific item within whatever group, this task force, the subcommittees, they could go through and perhaps find that information a little bit easier if it were notated. And again, we talked about GARE, and also Heather Flaherty and Megan Ballou volunteered to reach out to impacted communities and try to get some more representation within that subcommittee. And then all the other things that we discussed we've already covered today with our co-responder programs and various incarnations, behavioral health program, or behavioral health officer program rather. And I think that concludes the update for those 2 months. And unless Mike, I probably missed a couple of things, but if you have anything or anyone else.
No, Dan, I think you got it. If folks wouldn't mind, I'd like to elucidate just a teeny bit more. You know, one of the facets of a racial equity toolkit is really about the representation, who's at the table, who's invited to the table, and who's not. And you alluded, Dan, to some of the discussions around that. And I think that the reason why I wanted to highlight that, I think it's worthwhile for the task force as a whole to consider that. Some of the ideas, Mike Hilly had one, I'm not going to try to paraphrase his entire idea, but, you know, I think it talked about maybe even semi-annual or quarterly, you know, roundtable discussions, that the participation in this committee could look different than just a monthly showing up at our Zoom webinars. And that really could be a way to increase some representation from folks who are really directly affected. So I just want to highlight that to this group, because I've heard from many members on this group how pleased they are with the work of this task force, but also some regrets over folks not at the table and some of our efforts that we could have done better.
Yeah, thanks for bringing that up. That Mike Hilly had it. That was a really good suggestion, I think, to try to look at just different ways that we can get not only the information out there, but also engage in dialogue with folks. Part of that came from the info listening sessions that the mayor and executives to do had. I believe there were 4 of them over the course of the late summer. Some of the we had a couple of folks that called into question, you know, what are you doing for children, for example? You know, we don't hear about that. Well, there's a whole contingent. Heather Flaherty and others are leaders in that are working on upstream diversion programs for children. And of course, we have the Bellingham Promise and the Bellingham School District. So I think it's a matter of just really being as transparent as possible and pushing out information. And again, as Mike Parker said, as it relates to inclusivity and racial equity, it really does come down to who's at the table. And so if we can expand the possibilities of what that can look like, I think we're just gonna be better off in terms of serving our community. And I'll stop there.
Okay, any other questions for Dan or Mike?
Stephen, can I just make one quick announcement?
Yes, please.
I apologize. I gave Jack the wrong information at the beginning of the meeting, and I just want to make sure everyone's aware that today's Behavioral Health Committee is rescheduled to tomorrow at 3:30 p.m., not Thursday. So the next meeting is tomorrow afternoon. Thank you.
Thanks, Jill.
Thank you, Jill.
Okay, the last substantive item on the agenda is a report from the Crisis Stabilization Facility Committee. And I guess, Anne, you're back on for that.
So in addition to talking about the funding issues that I've already addressed, the other thing we were talking about is a ribbon cutting ceremony and how we do something like that in the era of COVID. So first of all, construction is moving along. We will be touring some of our county council members this afternoon through the facility. Hopefully it will be ready for occupancy sometime toward the end of November. And right now, the treatment providers are trying to finalize their negotiations for reimbursement from the MCO so they can then start their recruitment process and hiring. So hopefully December, more likely beginning of the year, we'll open it up. With that said, we obviously aren't going to have a large gathering and a big ribbon cutting ceremony like we typically have, but some great ideas we came up with is maybe we would do a virtual tour and record something that can last a lifetime. And part of that will include the external camera that's been running from beginning to end. It was put on the Work Release Center building, and it just shows one side of the building. So unfortunately, it wasn't quite high enough to show all of the activity, but it is kind of fun to see a time-lapse video. And then I think we'll do a walkthrough tour as well. And I'll work with the county exec's office on how we put together a ribbon cutting ceremony that makes people feel like they can still celebrate this major accomplishment and also be able to see everything really up close. And then as we get closer to opening, I'm certainly willing to set up some tours with some small groups of people if you really want to see it firsthand. So that's what we were up to.
Thank you, Ann.
Oh, I'm sorry, I missed the most important piece probably, which was the whole issue of the mental health side of the unit being an involuntary triage placement. That is still the goal for that program. The treatment providers are trying to get the managed care organizations to pay for the level of staffing required to have an involuntary treatment facility. And I think that we have lots of work to do there still, but it would be a great disappointment to open this up and not have the involuntary piece as part of it. So that's, again, a lot of work ahead of us to not only identify the appropriate people to be diverted there and held with a police officer hold, but how we make sure that we can do that safely and effectively.
Any questions for Ann?
Yeah, we've got Dan Hamill's hand up.
Quick 2 questions. And Deacon, can you just remind me for involuntary commit for this facility, if in a way that you want to have this, how many hours is that for? And then second question is, you said beginning of the year for opening, will that be full capacity or partial?
So full capacity is planned beginning of the year. Yes, 16 beds each side. The triage facility has an RCW that it follows that allows for a police officer to hold up to 12 hours. And within 3 hours of arrival, they must be assessed by a mental health professional, not necessarily a designated crisis responder, but just a mental health professional to make sure that somebody has taken a look at someone's mental status and that if there are other needs that they address those, which would include perhaps bringing somebody, a DCR, into the facility to investigate the possibility of a civil commitment. So this is a, quote, criminal code commitment that we're going to be using at this facility. But if somebody is civilly committed while they're there, the facility can certainly hold them long enough to find an appropriate placement where the civil commitment treatment can occur, the involuntary treatment.
Thank you.
You're on mute, Stephen.
I'm sorry. Any other questions? Okay. Jack, do you want to take other business and bring us home?
Sure. Do we have any other business? I'm not aware of any. All right, so this is the time in the meeting that's available for public comment. I see we have 4 members of the public that are in this session, and if any of them would like to speak, I'm not quite sure how. I think you can unmute, and if not, oh, Moonwater, is your hand up to speak? I see your hand up.
Yes. Hi, everyone. I'm just calling in today. I just wanted to briefly acknowledge that I wasn't quite sure how to insert myself into the conversation previously, but I'm just appreciating the content of today's meeting and also want to affirm the Dispute Resolution Center's commitment and interest in supporting the prevention efforts in particular. I'd love for my staff to be connected with folks that are talking more intentionally about youth diversion efforts. So for Heather and Dean, just be aware if we could connect, and I'd love to link you to my youth staff in particular. And then for some of the other behavioral intervention programs that are being explored and vetted, I'll just ask, since it's difficult to sort of be at every table where folks are having these conversations, to keep the DRC in mind. And I just encourage folks to reach out to me, and I'll do my best to reach out to other folks as you're involved in the exploration of some of those programs to see how the DRC might be able to be of assistance, both through training efforts and then also in creative problem solving, because we have had partnerships in the past with the Bellingham Police Department where if there's civil matters that folks have been called out for and the police are unable to support that, sometimes those cases have successfully been referred to the DRC for mediation and other types of intervention or conflict coaching. So I'll just offer that here, just to have that in folks' mind and to please reach out to me if I can be of assistance in providing more information or supporting some of that brainstorming. Thanks, everyone.
Thanks, Moonwater. And sorry, I don't know how long your hand has been up. So I apologize if we didn't get to you sooner.
Not long at all.
Okay.
It's technology on my end.
Oh, no problem. For those of you that don't see her, she's in, I think it says a call and it showed up in the waiting room, not the panelists, and I should have monitored that as well. All right, this is the time for public comment. Would any of the members of the public that are here like to make a comment? I'm clicking allow to talk for all three that are there. Okay, I'm assuming then that the answer to that is no. And thank you, Holly, Mark, and Perry for joining us. Seeing no other business, unless someone has a reason otherwise, I believe we're ready to adjourn. That sound about right, Stephen?
Yes, it does.
Oh, Barry's going to serenade us out.
Have a good day, everybody.
Thank you. I wasn't going to adjourn until you finished playing. I wanted the recording to get your audio.
Oh, there wasn't much there.
All right, everyone. It is almost 10:30 on Monday, October 12th, and we are adjourned. Thank you for attending the meeting.
Thanks, everybody.